One of the strengths of our residency program is the depth of the ICU experiences and the level of comfort that our residents have in taking care of very sick patients. In addition, the procedural experience here is unmatched. The first year block schedule is similar to most emergency medicine training programs. We have 9 emergency medicine rotations, including an orientation month. There's a pediatric emergency medicine experience, and we have rotations in trauma, MICU, anesthesiology, and orthopedics to complete the 13 4-week blocks in our schedule. The second year is heavily weighted towards ICU rotations. In addition to the emergency medicine rotations, we have a pediatric emergency medicine experience. We have additional rotations in cardiothoracic ICU, cardiothoracic anesthesiology, pediatric ICU, surgical ICU, obstetrics, and ultrasound. Our electives are similar to electives in most emergency medicine programs, where we have electives in plastics, ENT, orthopedics, EMS, advanced ultrasound, advanced administration, advanced toxicology. However, we also have a unique rotation in Honduras at a hospital that sees 292,000 patients per year, one of the busiest hospitals in the world. We do trauma and OB there. The third year is much more heavily weighted towards emergency medicine rotations. Out of every emergency medicine rotations, there are several peds emergency medicine shifts spread throughout the month. In addition, there were rotations on trauma, surgery, EMS tox administration, where you help with toxicology podcasts, do tox consults, work with administrators for the emergency medicine rotations, and also work with emergency medical services. There's also a neuro ICU / neurology rotation. The electives, as we said previously, are similar to a lot of other electives in addition to the global elective, but we also have a sports medicine elective where we work closely with Coastal Carolina University in taking care of their athletes. Here are some pictures of our work in sports medicine. Our sports medicine elective with Coastal Carolina University has worked out extraordinarily well. We've utilized our prior experience working with the NFL to enhance our rotation here in Myrtle Beach. We are very proud of our conference curriculum here at Grand Strand Medical Center. In addition to the sign-out rounds, we do a Wednesday grand rounds that's 5 hours weekly. This includes reading group, foundations, and multiple lectures, including lectures from outside faculty. And this is followed by small group simulation labs. Journal club conferences are done at faculty members' home, and there's some multidisciplinary conferences that we participate in. The Foundations curriculum is small groups and has been very well received and is utilized by over 50 training programs in emergency medicine. The residents have performed at least 10% better each year in comparison to peers of their same year on the in-service training exam, and we feel that this is a marker of an outstanding educational experience. We have recently opened a new sim lab and do a difficult airway course every month, and the residents help teach that to individuals from outside our hospital system. In addition, we do a lot of work with procedural labs and different simulations, including toxicological simulation and pediatric sim. There are a large number of procedural, clinical, and physical exam scenarios that are incorporated into the sim lab. The research opportunities at Grand Strand are excellent. We have access to a biostatistician and have a research coordinator. We have had an emphasis on trauma, ultrasound, toxicology, marine envenomations, including jellyfish, stingrays, snake and shark bites, drownings, EMS, and health services. In addition, we have access to a huge HCA database of 168 hospitals where we can utilize information that has been pulled from these different sites to look at issues on a larger scale. We have over 60 scientific publications, including original publications, abstracts, book chapters in the last 5 years, and have been involved in editing a number of books.